to The Time of Your Life with the Baltimore County Department of Aging. I'm your host, Ethel Rasmussen. Today's show keeps you in the know by conveying important and interesting information about the contemporary topics that impact you, our viewing audience. With the holidays approaching, the season of giving is upon us. What better way to give than to share your time and talent by being a volunteer? Allison Vogren, Director of the Retired Senior Volunteer Program at the Department of Aging, is on the show to talk about the RSVP program, along with a range of volunteer opportunities. Also on the show is Debbie Orlov, Community Business Liaison at the Department of Aging. Debbie closes the show with information about senior center travel, senior box office, and what's happening at your local senior center. Let's start today's show with an important topic, Medicare. Navigating Medicare can be quite challenging. To learn more about Medicare, let's start the show with Sherry Kolbe, Program Manager of the State Health Insurance Assistance Program, known as SHIP, at the Department of Aging. Welcome to the show, Sherry.
Thank you, Ethel. It's always great to be here.
Before we start our conversation about Medicare, can you briefly discuss the responsibilities of the State Health Insurance Assistance Program, known as SHIP?
Well, when Medicare was created, there really are no local offices to go to in the community. Therefore, SHIPs were established across the nation, and the mission of my office is to educate Baltimore County residents about their Medicare beneficiaries. And I do that through a team of very, very dedicated volunteers who assist with the counseling.
So let's talk about what we're here to talk about, Medicare. What is Medicare and who is eligible?
Well, Medicare really is a federal benefit. When we don't really often realize that the laws were passed by Congress and that the Center for Medicare and Medicaid Service establishes the rules and the policies. Who's eligible for Medicare? Well, those of us who age in at age 65, individuals who have successfully applied for Social Security disability, they get Medicare the 25th month they receive a check. Those who have their 4th month of renal dialysis, kidney transplant, and those with Lou Gehrig's disease are eligible for Medicare.
How and when should prospective beneficiaries enroll in Medicare?
Well, this is a very important topic. First of all, whenever somebody, if you're already receiving a Social Security benefit and you age at 65, you'll automatically get your Medicare card in the mail 3 to 4 months before your 65th birthday. If you are receiving a Social Security disability check, you will also receive your card in the mail about 3 to 4 months before the 25th month that you collect a check. Otherwise, you must take action. You need to apply for Medicare A and B through Social Security. And you can either go in person, you can go online, you can call them. And the initial enrollment period that you need to contact Social Security at this time is 3 months before your 65th birthday, the month of the 65th birthday, and 3 months afterwards. So it's a 7-month window for you to enroll in Medicare A, B, C, and or D. Now, if you or your spouse are actively working, then you may delay enrolling and have a special enrollment period later for Medicare A, B, C, or D. If none of those at no point there did you enroll, then you can have a general enrollment January 1st through March 31st to join. Your Medicare won't start until July 1st, and you may have a penalty because of the delay.
Well, you've mentioned different parts of Medicare. Can you go ahead and explain to our viewers what are the ABCs of Medicare?
Okay, Medicare Part A pays if you're literally admitted to the hospital. If you then spend 3 midnights in the hospital and you're transferred to a skilled nursing facility. If after that you need some skilled home care, PT, OT, speech, and it also pays for hospice. Medicare Part B pays for the doctors, whether you're admitted to the hospital, in the ER, clinic, office. It pays for the doctors, blood work, x-rays, MRIs, durable medical equipment, even your flu and your pneumonia shots. And that's Part B. Part C is your Medicare Advantage plans, Medicare HMOs and PPOs, which literally are really substitutes for Parts A and B. For those private companies, Medicare, or rather the Center for Medicare and Medicaid Services, pays them to administer the original Medicare benefit for you. And with those plans, not only do you have coverage for doctor and hospital, but you also do, your drug benefit is enrolled in that.
All right, we're going to take a short break. When we return, we're going to continue our conversation with the ABCs of Medicare. Let's continue our conversation about the ABCs of Medicare with Sherry Kolbe, Program Manager of the State Health Insurance Assistance Program at the Department of Aging. Sherry, let's continue our conversation by turning our attention to Medicare Part D, which is Medicare's prescription benefit. Can you explain the benefit as well as some important facts to remember in selecting a plan each year?
Okay, the Part D benefit, first of all, is for those who do not have a retiree health benefit with a prescription coverage. Sometimes individuals are a little bit confused about that. The way the Medicare Part D works is that, first of all, at the beginning of the year, let's say January, your plan may or may not have a $400 deductible for 2017. And yes, that number did go up to $400. More and more plans are having a deductible, although there's still a few without a deductible. From the zero cost at the January until $3,700 in total has been spent for drugs between you and the plan, our person in that time range will pay basically 25% of retail for brand drugs, and the program will pay 75% of the drugs. When you hit the wall of $3,700, that's when our person hits the donut hole. And there, for 2017, an individual would pay 40% for brand drugs and 51% for generics. Now that number has come down from last year, and that number will continue to diminish until 2020, when the donut hole will be considered to be closed, because our beneficiary will be paying 25% across the board for the drugs, unless they take some really expensive drugs and hit catastrophic, where then they would only pay 5%. The important thing to remember about the Part D is that there are 18 Part D plans right now for Baltimore County, and these plans all vary, and the plans are permitted to change themselves each year. They're permitted to change their formulary, tier structure, premiums, deductibles, pharmacy contracts. So we highly, highly recommend every single year have the Part D research done, which is why we are actively going out into the community. I take teams out almost every single day, and we give one-on-one assistance. Let it come to us, let us check to see, is your Part D plan that you have for 2016 really the best for 2017? We had a woman last week, by changing our plans, we saved her $1,000. We can't save everybody $1,000, but let us check your plans.
It's good motivation. I understand some beneficiaries do need supplemental insurance or a Medigap. Can you talk about what is the information about these plans and when would you need them?
Okay, if they just use their red, white, and blue card, there are many holes in Medicare where you have to pay out of pocket. And some people say, well, I don't really like that. So therefore, they want to buy an insurance that will literally fill in the holes. And that's why a Medigap is called a Medigap. It fills in the gaps. All right, these insurances are first of all, they're overseen by the Maryland Insurance Administration, and they are private companies. The Medigaps range an alphabet soup of A to N. F is the most comprehensive, so it's the most expensive, and others, if you're willing to pay some out of pocket, you can have a lower premium. The time to buy these is the first 6 months you're on Medicare Part B. That's your guaranteed issue. After that, you will not have a guaranteed issue. Companies will look at your age and your health. They'll do medical underwriting to see if they would like to cover you, and not one of them has to. So if you really want a Medigap, it's best to get this in the beginning. There's confusion on TV. There's a lot of ads, and you hear open enrollment and Medigaps being advertised side by side. There is no open enrollment on an annual basis for a Medigap. It's only that first 6 months you're on Medicare Part B.
Okay. For those beneficiaries that may be on a limited income, can you talk about some of the programs that can assist with the Medicare costs?
Every time we get a call, we are always assessing income and assets to make sure people are on the programs that will help them. First of all, there's a program called QMB. The income level for this would have, for an individual, would have to be under $1,010, and their assets like under 8,700. Okay, the state of Maryland would pay the Medicare Part B premium, and they would get a gray and white card, which would pay co-pays and deductibles associated with Medicare for basically a free Medicare supplement. If the income's a little bit higher, they might be eligible just for SLIMB. That's where the state would only pay the Medicare Part B premium. Okay, people on those two programs are consistently eligible for full Extra Help. Extra Help is a program that you get through Social Security that helps pay for Medicare prescription costs. There, they would likely have no premium, no deductible, and pay in 2017 a little bit over $3 for each generic and a little over $8 for each brand. If their income's a little bit higher than those programs, maybe an individual's income's under $1,505 and their assets are a little bit higher, like $13,000, they can get partial Extra Help. If their income's even higher, then there's a program called the Maryland Senior Prescription Drug Assistance Program. The bottom line is, please call us. We would like to review to see if you're eligible for the programs, to get you enrolled in these programs so that you can get the help that you need.
Wonderful. In closing, is there any other information that you would like to add about Medicare?
Well, if somebody is new to Medicare, they need to call our office. We do transitioning to Medicare workshops on a monthly basis. We try to move them around the county, and also to please call our office. We are there with SHIP counselors Monday to Friday all year round to answer any question you have about Medicare. If we don't know the answer, we'll try to research it to assist you with whatever your need may be.
Thank you, Sherry, for sharing this valuable and informative segment with our viewers.
And thank you for having me.
We're going to take a short break, but first I'd like to tell you about BCDA's latest resource called The Last Chapter, which is now available. The brochure helps to support those who are faced with the loss of a loved one. The Last Chapter brochure is now available at your local senior center or MAP office. This resource is sponsored by the Redemptorist Cemeteries. When we return, learn about the Department of Aging's Retired Senior Volunteer Program, known as RSVP.